Brooke McHale is a art therapist. I believe there's some other degrees that have to do with that. And she works with me at Paley Cancer Center at the hospital. But if you get to work with people with cancer, they have a team. And, we know that the team members are like the doctors and the nurse navigators and the radiation people and the surgeons and all this, but we don't often think of the other pieces of an integrative team. And even when they do, they usually go to massage and Reiki and or hit acupuncture. But Brooke is an art therapist and so much more. And so we are so lucky to get her and have her on our team.
Thank you so much for that introduction. All right, so I just wanted to give everyone a little introduction to creative arts therapy. I'm not sure how much you all are familiar with, but just let me know if you have any questions throughout, or there will be some time after. Yeah, so hopefully this will give you a good overview, and yeah, we'll just go from there. So this is me. I just wanted to talk a little bit about how I got here because it's maybe a bit lesser known of the path to becoming a creative arts therapist. So I did my undergrad and I studied theater and psychology, and then wanted to continue with that, putting those together. So right out of undergrad, I went to grad school at NYU for drama therapy, and I've been doing this for a couple years now. So I'm pretty new to the field, which is why it's awesome that I get to talk to you guys today. But yeah, hopefully I can give you a good overview of what I know so far. So these are just some things that are about me. And of course, I have two cats, love my cats. That's important to mention. And yeah, my credentials are I'm a registered drama therapist with the North American Drama Therapy Association, and then Master of Arts in Drama Therapy. But I am working towards licensure in Pennsylvania for counseling as well. So we're getting there. It's a long process. Okay, so this is a bit of an overview of what I'm hoping to go over today. So just a little introduction, an overview of creative arts therapies, sort of, why they're beneficial, and going into drama therapy a little bit more since that's my specialty, and then how these can be utilized in cancer care, palliative care, and giving sort of some examples of what that might look like, and how I kind of hope to move ahead with the program at the hospital that I work with Zerlin at, and just things for the future and some questions if you have them. So yeah, that's kind of where we're going. So creative arts therapies are kind of what they sound like, using ways to use the arts as therapy, integrating the arts with therapy, making therapy more accessible through the arts. And each creative arts therapist is trained in their respective art modality, whether it be like visual art or dance or drama, like me, and then also trained in psychotherapy. So that's kind of a combination of the program I was in was traditional counseling and then drama therapy. So I see it as like we are traditional counselors with the added art tools in our arsenal, sort of to make it more accessible. And creative arts therapists work in a lot of different capacities, whether it be hospitals, medical or psychiatric, in schools. I have friends who work in eating disorder treatment centers, nursing homes, kind of everywhere. So it's pretty all over the map, but I think that people are still getting to know what we do. So yeah, that's a little bit of an overview. Then looking at the different modalities, there's art therapy, which I feel like is the most common, music therapy, and drama therapy, dance movement therapy, and poetry therapy, which I don't know too much about. But yeah, I think it's cool that there are all these different kind of ways to go about it. And So now going into the benefits and just kind of the why, I thought that these quotations were some pretty great examples. So this one talks about art therapy and looking at the art as a container. So I'll just go ahead and we can read this together. So think of your artwork as a container. Your art can hold what you are feeling and provide an emotional release when life feels challenging. The creative, expressive process of making art can be self-soothing, helping your body and mind feel calmer. When you express your inner world through creating art and reflecting on the process and product, participants can increase awareness of self and others, cope with symptoms, stress, and traumatic experiences, enhance cognitive abilities, and enjoy the life-affirming pleasures of making art. So really anything from when life is challenging and you need to process things and taking that and putting it into art making, or also just self-soothing, using it for distraction from distress, gaining simple pleasure from it. So but I really wanted to highlight this piece about the containment of art and drama therapy. And then another piece about visual art, which helps to give choices back to the patients who have lost the ability to make many of the choices in their care, and empowering the patient to make decisions in art, to do things in art, to observe things in art, is important to their ability to cope with their circumstances. I think that's probably something you all have seen working with oncology patients, that there's a lot of choice stripped away from them, and sometimes decisions are made and they don't completely have a say, like they don't have a say over what's really happening to their bodies entirely. So art and that process can be a means of choice and autonomy and giving back some of that power to them. And this is a quote a professor of mine said once that I wanted to mention, a drama therapy quote, which is, "Recovery is a function of imagination." I feel like that kind of sums up drama therapy for me. So that's a nice little way to lead into drama therapy more specifically. So this is the North American Drama Therapy Association's definition of drama therapy, which is the intentional use of drama and/or theater processes to achieve therapeutic goals. And this can look like so many different things, which I'll get into in a little bit. It is an embodied practice. I feel like there's some connection there with massage, that we're both like very embodied practices, and it's active and experiential. And this approach can provide the context for participants to tell their stories, set goals and solve problems, express feelings, or achieve catharsis. Through drama, the depth and breadth of inner experience can be actively explored, and interpersonal relationship skills can be enhanced. So those are sort of the overview definitions there. But I definitely want to go more into kind of like what this looks like, because I think it makes sense, but then it's like, well, how do you do it? Like, how does this whole process happen? And so I think it can look anything from either like a group session or an individual session. And it could be like a traditional counseling session where I kind of look at things through a drama therapeutic lens. It's not necessarily like I'm going in and like we're writing a play together and we're like acting out a monologue right now. It's kind of like I can look at our session through the different roles that we each play in our lives. It really gives me a great look at the full person, not just their illness, or, that's what I've learned from drama therapy specifically, even when it's sort of not always at the forefront of my work, it is at the same time, just in maybe not the traditional sense that people expect. And let's see. These are the core processes of drama therapy, just to give a bit more of an overview. Dramatic projection, which is kind of like using different objects or characters or props to project an experience onto them. So let's see, for example, I don't know if you've heard of sand tray therapy, but like that is an example of projection. So basically, like there is a physical sand tray and then a bunch of different objects in the sand tray that have various meanings, and you kind of use those to create scenarios, project onto those things. So that's just one example, or like puppetry or different things like that. Therapeutic performance, which is well, kind of what it sounds like, I guess. So creating your own performance based on lived experience, or like an example is when I was in grad school, we all had a final therapeutic autobiographical performance we worked on with each other. So that's definitely something I'd like to focus on in my role at the Cancer Center, but I'll get into that later. Distancing, which is basically just creating space between what you're processing and working on in therapy and having some distance with it so that it's easier to talk about, if that makes sense. So an example of distancing could be I'm going to act out this monologue that is about something kind of like fantastical and imaginative and not my exact situation that I'm going through, but kind of a way to project onto that and talk about my experience in a way that's more distanced. Dramatic play, just play is a huge part of drama therapy, which I love. I feel like people, even adults, need more play. And that's kind of a misconception about drama therapy or art therapy in general, is that it's more like childish or better for younger populations, which is not the case. It's really like anyone can do it. And I think especially with illness, play becomes really important. Illness, trauma, it's a huge way to kind of reclaim some power and life. Representation and personification, interactive audience and witnessing. The role of the witness is really important. Just think of like a therapist and client. The therapist is the witness, and then translating that into like a theater sense of things, the actor and the audience. So you can kind of see that parallel there, if that makes sense. Embodiment, we talked about a little bit, and dramatic reality. Then multidimensional relationships. So just focusing on the interpersonal and role play and how problems can be worked out in that way. Okay. So this is kind of the lens that I personally like to work through in terms of drama therapy. So this is role theory, and it views human beings in terms of their behaviors in role. And role is a set of archetypal qualities representing one aspect of a person, an aspect that relates to others, and when taken together, provides a meaningful and coherent view of self. So a little bit more about what this can look like is this is an example of something called a role sort. So thinking about role, for example, like right now, you're in the role of witness, learner. I'm in the role of presenter or like therapist. I don't know, different like roles are everywhere. So here is an example of just so many different roles that we could be playing at any time, and they're on flashcards. And basically, the way that I can work with them sometimes is just laying them all out. And whether an individual or a group, they can kind of come in and see which role do I identify with today, and picking one of those and really speaking from that role. And it can kind of provide a different perspective than they were thinking of, or, you know, give them something to aspire to, a role they want to embody more, a way to expand their role repertoire. So you can use this as an assessment tool of like, can someone only see themselves as the critic today, or can they see that they are also other, like not just the critic, but can they also be a vulnerable one, strong one, a witness, or are they only seeing themselves in this one light? So it can be a goal to kind of expand the roles that we play. And yeah, there are tons of different ways to work with these. This is another example of using role theory as a therapist. So basically, I won't go too much into this, but Britton Williams is a drama therapist who was a professor of mine who created this relational role assessment protocol. So this is an example of one I did a few years ago, but looking at client roles and then my roles in the relationship and then where we might overlap. So that reflecting on that with this one particular person really gave me different insight as to what I was feeling in our work together, how they might be feeling, just different ways to think about things. So I feel like role can really be used anywhere, even as not necessarily a therapist, but just any kind of work that you're doing where you're interacting with another person and you're each bringing your own stuff to the table and what roles are coming out and what roles maybe need to like take a back seat a little bit to, make for a smoother interpersonal relationship. Just understanding where the person is coming from, and that's just a slight overview of that. Now moving on to creative arts therapy in the Cancer Center. So I've been in this role for only a few months now, so I'm still getting used to things, but I kind of just wanted to give an overview of what I'm up to there and, hopes for the future. So this is just a little promotional material that I made so people can kind of access the services better. Looking at a definition so people have an idea of it, what a session might look like, and then some benefits, which include emotional processing, stress reduction, physical pain relief, improved coping skills, enhanced communication, and overall well-being, which we kind of talked about, but it's just helpful for people to know what these services might add to their treatment in addition to everything else that they're already receiving. And hopefully this kind of provides something added to their experience.
Can I
Uh,
ask you a question, Brooke?
yeah, for sure.
Can you go a little bit more into some of these benefits, like especially thinking about physical pain, like how that works?
Yeah, of course.
Thank you.
Well, one way that this might work is simply through distraction and like putting energy elsewhere into something that we find joyous, or just giving us a different mind space. Let's see, there's people. Sorry, I'm just looking for something. Okay. Yeah, I think just reducing stress and channeling that into physical pain relief. I know there are definitely some measures of, like, before a session, how someone was feeling their physical pain wise, like rating it on a number scale, and then seeing after doing an art therapy intervention how the pain rating might go down. So I know there have been some studies that include that. And as far as how exactly it works, that's something I would need to look more into. But the studies are getting there. So I think that's really cool to see how pain can decrease sometimes just from art making and kind of processing more of what's really going on. Does that kind of begin to answer a little bit? Okay. I also am hoping to put together some resources for you guys on more of the research and literature that might also help to answer more questions if you ever want to look more in depth into things. So yeah, hopefully I'll figure out how to send those to you. And this is a quotation I was looking at with art therapy and cancer specifically, going back to kind of art as accessibility and helping people express experiences that are too difficult to put into words, such as a diagnosis of cancer. Some people with cancer explore the meanings of past, present, and future during art therapy, thereby integrating cancer into their life story and giving it meaning. So using, yes. Yeah, sure.
Yes, I mean, a lot of us, we can't even imagine how the patient feels, right? And yet there are people who will say, I don't want therapy. I'm not going to talk to a therapist. But then when presented with creative arts, do you
Mhm.
think that sometimes that softens it and makes it more palatable and they're willing to do it then?
Yeah, that's a good question. I definitely think so for some people. It can definitely be intimidating for some people, when art is presented, they're like, "Oh, well, I'm not an artist. I could never." But it's really, it doesn't have to be like that. So some people do just kind of like to start off by talking, which is fine. And then some people are the opposite way of, like I don't want to talk about my cancer today. I don't want to talk about the pain that I'm feeling. I want to draw it, or I want to write about it and like share it with you later, or write a story that kind of depicts that pain but is fictional, so adds some distance to it.
Mhm.
So there are different ways to go about things than just talking directly about it. So it's kind of up to the person and their comfort level with art, you know, how they want to go about their session. So it's always kind of up to them how much art they want to incorporate into the session.
Mhm.
Yeah, it's within their comfort level, but I'll always bring things up if I feel like it can help to give a different perspective or like dive deeper into something without causing harm. I think art can be a good tool for containment and distance in that sense. There's that. Does that answer? Cool. Yeah, this is just an example of some of the stuff that I do. So I do have an open art therapy studio group, which we're working on it. We're getting participants. I think the role of art therapist at Paoli in the Cancer Center is they kind of had to bring it back after the pandemic, Zerlin was telling me. So people, I think, were missing it for a few years, and now that I'm in the role, they're kind of like getting used to seeing me around and letting people know, like, hey, this group is happening. So kind of just we're figuring out how to get things going there. But the people who have come, there was someone who used it as a time to de-stress after their chemo treatment. So I guess she was in the cancer center for a couple hours and then afterwards came up and sat with me in my group and did a mandala for de-stress, like coloring. And, we talked a little bit and I think it was like a nice way to close out her morning of treatment. So that's just one example of how that group went, but hopefully as it expands, it can be a place where people can also build community. And yeah, we'll see where that goes.
I love that idea that there's a place that people can go when they're ready, but that they could also do it during the infusion. And I don't know, at your hospital, do they have group infusion rooms and individual rooms that people can choose? So
Yeah.
it could just be available in the infusion room, or someone could ask for it in the private room. That's really wonderful.
Yeah, thanks. I really wanted to try to make both of those opportunities available. So we can have that aspect of choice in there again. And, like people can, since it's an open group, they can like come and go and no one's like being forced into a session. So I do have some more examples of interventions maybe for this I could share at another time. I have like a whole list if anyone would be interested in that, but I don't want to take up too much time. But Then looking at creative arts therapy in palliative care and hospice / end of life care. This is just a little bit of an overview of that. There's some overlap with oncology, so I figured I would just include a piece of that. So the difference here is that it might be focused more on legacy work. So how someone wants to be remembered or how family can kind of preserve their memory. So fingerprints and a lot of things with hands are often used as legacy work, which I thought maybe could be of interest to you guys too. So there's that. There's different scrapbook or collage, self-portraits, cards, memory boxes, audio or video. And I feel like it's been good to work with the social worker in palliative care and kind of collaborate with her. So she builds a rapport with the patients over time and then kind of can introduce me into things and figure out how to help with legacy work and stuff like that.
Now I have another question. It is a tree. Okay. That was
Oh,
my question. Because I saw a tree like this in a room, a patient room that I was in, and they asked me to put my thumbprint on it. But
yeah.
the cool thing was the therapy dogs had their prints on there at the bottom by the tree.
Oh my gosh, that's awesome.
Yeah.
I love that. Love therapy dogs. Yeah, so this was something that I collaborated on with the social worker for a young patient and their family. It was a really difficult case for a lot of staff, and people became very close with this person. It was a younger person, so I think we don't really see that as much at this hospital, which is why it really hit people hard. And so this was not only beneficial, I think, to the patient and their family, but to the staff to be able to kind of put their fingerprint on this. It became like a bigger, fuller tree. So they could, the idea was that the patient could then see all the love and support on the branches. And so I think for staff to just like have something additional that they can do with the fingerprint, something creative, something that kind of like brings them all together in this way, was just a small little thing. I hope to do more stuff like this too. And then just want to finish up by what I'm hoping to do. Hopefully, some sort of creative mural for the Cancer Center would be cool. That's a lot of, I don't know, we'll see what happens, but like someday. Performance, which I think would be great, like a monologue showcase, if I can find people who'd like to work on that. And more support for staff. I was just talking about this a little bit, but I think especially nursing, it's stressful, especially with the the case I was just talking about. People were really burnt out, and there's been a little bit of research on art therapy and palliative care nurses and how we can support them. So I'm hoping to look more into that too. And yeah, hopefully expand research with drama therapy and oncology because there's not a ton of it. And yeah, I think that's kind of all I have. And then I'd also like to know if you have any ideas of how we might be able to collaborate as fields and kind of like integrate things. Zerlin and I have talked a little bit about it, but it would be great to learn from you as well. So yeah, and then my email, and that's about it. Thanks.
Brooke, thank you so very much for your information. We hope that there's a lot more people like you in the world, and we hope that we all get to work with people like you.
Thank you so much.
Yeah, I mean, the more we can help support the patients and their families, the better.